The Hazelden Betty Ford Foundation has set the global standard for addiction recovery for over 75 years. As the nation's leading nonprofit in behavioral health, they are now proving that even the most human-centric missions can be amplified through digital innovation. I'm Kerry Chow, joined by Brad Branham, Executive Director of Customer Experience at the Hazelden Betty Ford Foundation. First of all, Brad, thank you for joining us over here on Salesforce Plus.
Thanks for having me. Pleasure to be here.
Yeah, Brett, briefly tell us, what does your organization do, but also what were some of the big operational challenges you were facing at Hazelden Betty Ford?
Yes, so first of all, to introduce the Hazelden Betty Ford Foundation, we are a non-for-profit dedicated to the healing and hope for individuals, families, and communities dealing with addiction and mental health. Our mission is to empower recovery through a combination of science, love, and professional expertise, and to reduce stigma. Some of the big operational challenges are, first of all, from a patient-first perspective, how do you learn, become aware, and educated about addiction? And after that, what are the first steps? What are the options for me to get lifelong recovery? And then who is the Hazelden Betty Ford Foundation? Why would they be a right fit for me? And then internally, like most non-for-profits, we're really challenged with just the resources that we have, the funding, the human manpower that we can bring on board. So we're really trying to find ways to scale and amplify the human connection by introducing technology. Not replacing humans, but again, taking some of those low qualified conversations so it opens the door for more meaningful moments.
100%. And so obviously you partner with Salesforce to help address some of those challenges. What products are you currently using at Salesforce, and how are you using them?
Right, so our core CRM for the enterprise is really built on Service and Sales Cloud. But I would say the most exciting things that we've done over the past year is that we've introduced Agentforce Stack with Data 360, and have also moved from Pardot to Marketing Cloud Engagement. So what that has allowed us to do is start building our agentic roadmap, a warm welcome agent. Someone comes in, they have questions, they want to learn. We can answer that in an automated way, but we can also hand that off to a human in real time. We now have follow-up engagements, so people fall off the journey. We reach out Marketing Cloud through our journeys, and we're starting to find strategic areas to get them re-engaged that drives emissions.
I love that, like finding them where they are in that journey. Privacy, obviously, when it comes to addiction, is got to be a top priority for you.
Yes.
People come to the Hazelden Betty Ford Foundation in a vulnerable state. They need help, they need privacy, they need discretion. How does Salesforce help you prioritize that?
Yeah, part of our selection was we did evaluate some different products on the market, but where Salesforce really stood out is their Einstein trusted layer, right? Because we are really resource strapped, we really rely on our partners that have the rigor around security, things like pen testing, the ability that we could bring our own language model to then start building on top of in the Hazelden way to add an element of unique empathy, tone, motivational interviewing. So we've really developed a clinical counsel around that too to crowdsource governance as we continue to look at those conversations and make those tweaks. But the key to that was that they brought all that security to the table so that we didn't have to do that. And then we really partnered with our internal compliance legal security teams to really just augment that and continue to learn together. None of us are experts yet in AI. We're really at version 1.0. And I think as we partner together to focus on patient-centric design, we'll continue to execute effectively.
Just you talking about using the specific Hazelden Betty Ford vernacular and language and empathy amongst its agents just sounds like an exciting opportunity for y'all.
I think so. I think it's we're really trying to move our digital front door, not to the point where patients have typically and historically come to us. Sometimes they're in a moment of crisis, but we realize there's a lot of opportunity to catch them earlier. They don't have to wait until the last minute. So now we're moving the digital front door to where it's more accessible to them through our digital channels such as texting and chat. And now they can have conversations. They get those questions answered so they know what addiction means, what level of severity, what are the right options, and take that next step. So it helps those people to be seen early and create connection much earlier in that journey.
You've kind of just answered my next question for you, but like, what's next when it comes to the Hazelden Betty Ford Foundation in terms of just your technology vision overall?
I'm really excited about our vision for the next 1 to 3 years, mostly because we're getting all the foundation laid today. But next is going to be our omni-channel, multi-channel contact center. So with Service Cloud Voice, we're hooking in all those channels, so now that the conversations become orchestrated, and we have a single platform with AI and Data 360 that we can start leaning into more personalization. We're also going to activate a mobile engagement channel that is going to be built and owned by Hazelden at the end of this year as well. So the idea is that we're going to now be participating in that product space where we have a great group of clinicians on the back end. You come to the Hazelden doors, we're really good at care. But now we need to participate in more of the front end where the younger generation is going to the product app store. They're going to online tools to ask for care and for help. Now we're going to be a trusted brand that's going to compete in that space. And I'm really excited about that opportunity.
That is exciting, and exciting that Salesforce can be a part of that journey for y'all. Y'all are already trailblazers in this space. I'm curious, what advice do you have for other organizations that might be looking to get started on their digital transformation technology journey?
Yes, I would say obsessive agility, right? Start small. When we build our roadmap, we have a tendency of wanting to do everything in one technology solution. So it's from the point of prospective patient, through patient care, through alumni engagement. And for us, it was, well, let's take that first step and build an agent around there that can be orchestrated. Someone walks in our doors, we just want to get a chance to understand them, meet them where they are, again, treat them as a human, and then if we needed to hand off early, we have the trigger points to do that. But the next point might be answering questions around insurance, answering questions around referral, or what does medical detox mean? We're going to continue designing and building and deploying those agents as we continue to take people down those intelligent digital pathways.
And I'm just thinking about the opportunity as you deploy that and build those agents to solve for those initial inquiries, the amount of time it frees up your employees to do that human connection that really makes them what they are and makes them special at what they do.
What's interesting, I think, to start seeing is how it's interwoven into the current engagement that already exists. So for example, historically, the only way that people really engage with us was a phone call. So you have someone who's in a time of need calling someone they don't know at the front end with very personal stories. Now they can start that journey in our chat experience or maybe texting, right? Now we see our phone call and our phone team starting to free up for the human connection moments that matter. Person needs crisis wide array. They need to get in the door. They need to answer a question about their kid. So that is starting to free up those time, and you got to look at how all those things are balancing and helping each other out.
Incredible opportunity. I really appreciate you, Brad, for joining us on Salesforce Plus and sharing your insights on how the Hazelden Betty Ford Clinic uses Salesforce. Thank you.
Thank you. Appreciate it.
To see how Agentforce 360 for nonprofits can help streamline operations for your organization, go ahead and scan the QR code on your screen.